A South African expert believes that the country has passed the peak of the fourth wave of COVID-19 infections. Her announcement follows the identification and rapid spread of the Omicron variant in the country.
Well, I think it indicates that we are past the peak of the fourth wave. So I think it was a short wave that we predicted that when we start seeing really the huge amount of cases. So there was a very steep increase from baseline to the first week. You remember in the last week of November, we were really seeing a lot of cases. So we predicted, that this wave was going to be quite narrow. And I think that's what we are seeing, the decrease in cases. It's that we had a lot of infections, so people really start creating immunity in the community, and so there are not that many susceptible individuals that will be infected. So it's epidemiologically it makes sense.
Now we're joined by Dr Angelique Cootzie, the chairperson of the South African Medical Association based in Pretoria, and joining us, of course, via Zoom from Pretoria in South Africa. Thank you very much, Dr Cootzie. So good news coming out of there, South Africa, on the decrease in virus cases. How important is this during the festive season?
Yeah, thank you so much for asking us, and a good day to all your listeners and viewers out there. I think it is important that one gets these numbers down, before your real festive season starts. It starts, in less than 72 hours from now on. So we are cautiously optimistic. We know that this these numbers might increase next week again, or the week after next week, the first week in January. And we would like to again encourage people to get vaccinated for those that's not, and again to keep these numbers low, to avoid any places where there's a lot of people, these big gatherings. We know that it's Christmas. We know that families are going to come together, and we would also, and it's not only for South Africa, any other country as well. Please wear your masks, especially if you're in-house or indoors. It is a sure way for the virus to spread. If you have it subclinically, you don't have symptoms yet. And remember, people are not sometimes with any viral infection, 2 or 3 days before you start with symptoms, you're already contagious. So that's why the mask wearing is so important, as to try to reduce these infections and try to keep the numbers low.
And Dr. Cootsie, like you said, it is Christmas. It is time for families to get together. It is not every country that is witnessing a decrease in cases like South Africa. Majority of the countries across the world are having an increase. So how do people travel during this time, and how do they enjoy this festive season safely?
So you have to understand, this is our 5th week with Omicron. So we are ahead of a lot of other countries. And we did see our doubling of our numbers, especially in the first 2 weeks, 2 to 3 weeks. We did see it. We look at all our stats. However, since around about the 9th, 11th of this month, we started to see that the increase are not so steep anymore. We know that Gauteng, which was the epicenter, is the economical hub of South Africa. And what is going to happen is that people working in Gauteng province will now start to move to KwaZulu-Natal or Western Cape. Traditionally, a lot of people live there and their families are there. So we also expect to see an increase in the numbers of KwaZulu-Natal and Western Cape. However, if the total number per day is less than it was at the peak, we would still be quite happy. And again, we keep on asking, please, wear your masks in the taxis. But we know what happened in taxis. We know that the taxi would be overloaded. There's nothing, you can do about that. That we need to start to learn how to live with this virus. And for now, South Africa hasn't introduced any other stricter restrictions. As I said, as long as our healthcare facilities are not overrun by the virus, or by severe infections causing our ICUs to run into trouble, we are then feeling comfortable at this stage. It might change in 2 to 3 days, but for now we are comfortable with the fact that we know our people are traveling, and we know that there might be a slight increase in other provinces. As I said, as long as the total number stays low, as well as our hospital admissions are not increasing in ICU, then we can live with this.
All right, and very key what you said, we've got to learn to live with it. Thank you very much for joining us, Dr. Angelique Cootzie.